Health authorities in the Democratic Republic of Congo have confirmed an Ebola case in the eastern city of Goma. Goma is a densely populated urban center and it is currently under the control of the Rwanda-backed M23 militia.
So the population should not panic. Everything is under control, and in our area, everything is being handled in North Kivu, where there is already a confirmed case, and in South Kivu, mutatis mutandis, we will do the same as what was done in North Kivu. Therefore, the two meetings have been held and the means have been provided. Medical staff are in place, technical teams are in place, everything is already under control.
The person detected with Ebola in Goma had reportedly come to the city after her husband had died from Ebola. The latest development comes as the DRC battles a rapidly spreading outbreak linked to the rare Bundibugyo strain of the virus. It is the strain for which there is currently no approved vaccine. Clinical symptoms include fever, bleeding and multi-organ damage. The disease has a fatality rate as high as 50 to even 90%. The outbreak in the DRC has so far been centered in the Ituri province in northeastern DRC near the country's borders with Uganda and South Sudan. Containing the outbreak here is complicated by the constant movement of people. There is a lot of gold mining activity in the province, which also suffers from regular attacks by the armed groups active in the region.
It is an epidemic that will spread very rapidly, all the more so as it has broken out in a densely populated province, with a high concentration of people and a great deal of population movement. And then, of course, there is the added complication that there are many armed groups in this province. That is what will make managing this epidemic very, very, very complicated.
According to health officials in the DRC, at least 88 people have died, while more than 300 suspected cases have been reported. The virus has also crossed borders, with Uganda confirming a related death. The World Health Organization says the Ebola outbreak poses a serious regional threat. Medical teams warn the response is being complicated by insecurity, armed conflict and weak infrastructure in eastern DRC. Experts believe fruit bats are the natural carriers of Ebola, though interestingly, the bats themselves do not fall ill. The virus can also spread through other infected animals such as apes, antelopes and porcupines before being transmitted to humans. Human-to-human transmission happens through direct contact with the bodily fluids of infected people, including blood, vomit and other secretions. Traditional burial practices involving physical contact with the victims have also contributed to Ebola spread during outbreaks. Unlike some respiratory diseases, Ebola does not spread through air. However, once infected, patients face a very high risk of death.